According to my observation on Tom's video, I can say that he had a lesion on the left side of the brain, right at the motor cortex. This area is right behind the frontal lobe. The motor cortex is the area on the brain that controls planning, control, and execution of voluntary movement. A lesion to this area can cause muscle weakness and decrease muscle control of the affected area. Watching Tom's video tells me that he has a right subluxed shoulder. He had a little bit of elbow flexion. He demonstrated muscle atrophy. That's what I could observe. He also mentioned no pain, but pain sometimes in certain positions, as well as some scapular winging. And a treatment idea is weight bearing. Weight bearing is great to help regulate and normalize muscle tone. Patient putting the affected arm on a surface where he can put some pressure in it. Also helps for sensory input if sensation is being lost. Another OT treatment can be using the skateboard over the table to help synergy, flexion, extension of the elbow, movement of the shoulder as well. Another treatment that I would recommend will be the use of tape, kinesio tape for subluxed shoulder, because research has shown that using tape, kinesio tape on a subluxed shoulder will help decrease pain with activities, will help increase passive range of motion of the affected arm, and will help provide a stability of the joint, and it will decrease immediately the subluxation by keeping the humerus in place. This will give the patient the possibility to participate better in OT treatments and activities at home. Another thing I forgot to mention is the kinesio tape is being used to help decrease edema as well. Now let's talk about some strategies that can be given to the patient to increase occupational performance. Let's start with visual. Visual is very easy to forget about the affected side because we are not aware of it after a stroke sometimes, right? So not being aware of the right side, I would recommend the patient to always keep their affected arm and in front of them in a way or other, on a table, on a chair, always making sure the affected arm is touched or looked at to prevent accidents. For example, after a stroke can be some sensory loss too. So if the patient completely forgets or doesn't look at what's going on with the right side, he or she can have his hand in hot water or on the stove and not notice it and not feel it and then burn himself, right? Another strategy, for example, for cognitive, let's talk about cognitive um, um, awareness of the affected side. Just it goes in hand with visual. Keep in mind, keep always stay aware of the affected side. Don't neglect it. For psychosocial, it's very important for the patient to stay in contact with friends, family, and to keep participating in activities that was maybe not in all of the activities that the patient was able to do before prior to the injury, but still participate on some of them, like going to a park, picnic, family gatherings, something that can help the patient stay motivated. And also here's where we talk about the behavioral part. That's another strategy to avoid anxiety, stress, sadness, depression. All these things can happen when a patient has a stroke. So psychosocial with behavioral will go together into maintaining as normal as possible, and stay in their lives as normal as possible as they can.